This is more information about what you need to know if you get a kidney stone. The first thing is you need to know when to go back to the ER or call your physician. This usually means you're getting sicker or the pain medicine isn't working. So any fever above 100.5 or having significant shaking chills, that's a reason to get back to the ER or call your physician. That can be one of the signs of sepsis. It's one of the signs of infection that may be going on with this stone. And when you have an obstructing stone and infection, it's just a recipe for disaster. So watch for fever, shaking chills, also intractable pain if your pain is not controlled with pain medication. If you're throwing up, you're nauseous, it's not controlled, usually you're going to need to go back to the hospital, perhaps be admitted and receive IV pain medication or IV nausea medicine. Other signs that can signify sepsis or bacteremia, which is infection actually in the blood, is mental status change. So if someone's not right mentally, that can be an early sign of sepsis. Swelling. If there's an obstructing stone, one kidney may not function properly because it's being blocked. So swelling of the legs and the extremities can signify renal dysfunction or renal damage that may be ongoing. Now, there's a big difference in passing your stone at home when you are feeling well and able versus being sick, having these fevers, not doing well. Those patients are at risk for what we're talking about, urosepsis. And again, an obstructing stone and infection, it's a recipe for disaster. People get very sick. These are patients that oftentimes present to the hospital. They're sick. They go to the ICU. Their body is fighting. And usually what they need is some type of decompression of that kidney, either with a stent that gets placed or a nephrostomy tube that gets placed directly into the kidney. There are some things you can do at home to help pass your stone. The most important thing is staying hydrated. Plenty of fluids, and it's usually low sugar fluids. So water is probably the best. You can mix Gatorade or electrolyte in that water to stay hydrated. But the goal with staying hydrated is to cause the kidneys to make urine, and then that urine will help push this stone through. The second thing you have to do is strain your urine. Always strain your urine. Otherwise, you may never know that that stone passes. Stone pain can be intermittent, and so you can have pain at one moment and then it may go away. You may think that stone has passed, but it may just be sitting there. Usually the pain comes when the urine doesn't get past the stone, either from the stone blocking or more likely swelling of this inner part of the tube, the ureter. Straining your urine is important to see, did you pass that 2 millimeter stone? Is what you passed 2 millimeters or is it 5 millimeters or whatnot? So important to strain your urine. Medications, pain medication, non-steroidal anti-inflammatories like Motrin or acetaminophen, things like that can be used to help with discomfort. There are other medicines like Flomax. Studies show that it has been shown to help relax this ureter. In stones, especially distal stones less than 5 or 6 millimeters, have been shown to pass easier with use of Flomax. There's also some over-the-counter supplements like bladder spasm medicine that can help with irritation. So use these medications as you need. It's important to keep your appointment with your urologist. Your urologist is a doctor that deals with kidney stones. So he's the one that would do surgery if surgery is needed. Only about 20 to 30% of patients don't pass their stones. So if you're in that group and you need to see a urologist, it's important to keep that appointment with your urologist. Heat is also something. Getting in a hot tub, a warm tub, a hot shower. Heat can help dilate the tissue, dilate blood vessels, and it can also help with discomfort with a kidney stone. Stretching the sides of the flank, the thoracic area, stretching those areas also is something that I recommend to patients when they are trying to pass a stone because it can be helpful. And then the last thing, how to interpret your CT scan findings. You need to know a couple of things on your CT scan. One is you need to know the size of the stone. Is it a big stone or a small stone? Bigger stones are less likely to pass. Smaller stones have a much higher rate of passage. So if you have a 1 or 2 millimeter stone that's down in this tube and it's by the bladder, you're going to have a 90 to 98% chance of passing that stone. A 3 to 4 millimeter stone, now you're talking 80 to 90% chance of passing that stone. A 5 to 6 millimeter stone, you're probably talking 60 to 65% passage rate. But when you get above 7 millimeters, which is a really good size stone, the rate of passage is probably somewhere around 30%. And that percentage goes lower as the stone gets bigger. This tube is only able to stretch to about 8 millimeters. So if you have a 7 millimeter stone coming through here, it's possible that it gets blocked, it doesn't pass. You may get some swelling of this tube, which also may make it difficult for the stone to pass. One of the factors that really plays a part in your ability to pass a stone is it a sharp stone? Does it have all these jagged edges that will irritate the lining of the ureter? Or is it smooth? If it's a smooth stone, sometimes these bigger stones are able to be passed much easier. The second thing you need to know is your stone in the kidney? Or just knowing the location of the stone. So is it in the kidney? Here, here. Or is it in what's called the UPJ, which is the ureteropelvic junction? That's this area here. That's called UPJ. This is the beginning part of the outflow of the kidney. Is it in the proximal ureter, the mid ureter, or the distal ureter? This is the distal ureter. Knowing the location of the stone is important. If you have a stone up high like this, it has a ways to travel down that tube and into the bladder. Sometimes that can take a day. Other times it may take a week, 2 weeks, 3 weeks to pass this stone on through. Another thing on your CT scan is what's called hydronephrosis. Hydronephrosis is dilation of this tube, and it's common. It's often seen in patients with kidney stones, and it's an expected finding. But what it is shows dilation of this tube and swelling of the kidney because of blockage, either from the stone or again from swelling. When you look at your x-ray, you also want to make sure that there's not a fluid collection. Fluid collections with kidney stone involvement can signify urine being in a place where it's not supposed to be. So you could have a ruptured calyx because of the pressure of this stone building up.